In this time of uncertainty, it's important to remain vigilant, but also to be calm. And most importantly, get your vaccine if you haven't, and receive your booster shot. Booster shots provide a high level of antibody as well as increasing levels of other aspects of the immune response, which strongly suggests that vaccination will give you some cross protection against a number of variants. Okay, so let me turn to our citywide response. Boston is focused on 4 key strategies. Strategy number 1, increasing access to vaccination, including boosters. So we're going to double down on our efforts to increase citywide vaccination by making vaccine clinics more accessible throughout the city. Anyone who wants a vaccine or a booster must be able to get one. So where should you go? So we're currently supporting 7 walk-in clinics in Dorchester, Mattapan, Roxbury, High Park, and Roslindale where no appointments are necessary. You don't need to go online, just go. At these clinics, anyone can receive a booster, and people 5 or over can receive their first or second dose of vaccine. We're also collaborating with our community partners to establish higher capacity vaccine sites ahead of the winter holidays. 4 of these higher capacity sites are planned for Saturday, December 11th, December 18th, and 2 Saturdays in January. The first of these larger capacity clinics will be held at Vine Street Community Center in Roxbury. We are also setting up a site here at City Hall on Thursday from 10 a.m. to 5 p.m., 3rd floor, where we are right now. This site is open to the public, not just to city workers. We will announce additional locations throughout the week, and for more information, call 311 or go to boston.gov. I also think it's important for us to mention Boston Public Schools. We need to increase our vaccination amongst our children. Students and their families will have increased access to clinics at schools across the city throughout December and throughout January, thanks to partnerships with BMC, MGH, and Tufts. Additionally, the Commission is providing dedicated clinical leadership through Dr. Sarma Sanchez, Director of our Infectious Disease Bureau. She will essentially be detailed to BPS to work on understanding and developing new policies regarding COVID-19 mitigation in our schools and scaling up the school vaccination program. Turning to strategy number 2, increasing access to testing. We need to increase access to testing, especially in our hardest hit communities. To do that, we have recently purchased and will be providing 20,000 free rapid antigen home tests to communities where they've noted the highest rates of COVID-19 and high barriers to purchasing test kits on their own. With the help of our vaccine equity partners and other community-based organizations, we will be distributing these free test kits as well as masks during the holidays, actually prior to the holidays. Each kit will include information on what to do if you test positive and direct you to contact the Commission's Infectious Disease Bureau to report your positivity and to receive additional instructions. Turning to strategy number 3, it's increased healthcare communication. So we're redoubling our efforts to increase information access about vaccines and boosters for all ages, especially children. Most of this work will involve our vaccine equity partners who are funded to lead community outreach. I want to mention our vaccine equity grant participants because really they have done a lot of the boots on the ground work to get vaccination increased in our communities. So they are the Black Boston COVID Coalition, BMC, Mattapan Community Health Center, East Boston Neighborhood Health Center, Harvard Street Neighborhood Health Center, Equity Now and Beyond, Chinatown Collaborative, Greater Boston Latino Network, Boston Centers for Youth and Families, and Four Corners Main Street, as well as many others. We're also partnering with other city departments to educate Boston residents, and that includes the Office of Emergency Management, Age Strong, and Boston Housing Authority. So lastly, but certainly not least, we need to redouble our efforts to prevent the spread of disease, particularly in light of this new variant. The city's indoor mask mandate will remain in place. It applies to all indoor establishments that are open to the public. And as I mentioned, we will be giving out masks with rapid test kits throughout those communities where we've noticed higher risk. And as has been the case throughout the pandemic, physical distancing, hand washing, and proper ventilation remain critical for preventing the spread of COVID-19. In addition, please monitor yourself and your children for COVID-19 related symptoms. And also, if you haven't already, get your flu shot. I look forward to working with Mayor Wu and our new COVID-19 Advisory Committee and many other partners throughout Boston on these 4 strategies.